Hey, it's Dr. Troy here from Zenaptic Chiropractic, and I encourage a lot of our patients to stretch and foam roll. And the ones that listen to me and do it are told, they're the ones that get the best results. And that's really what we want for our patients. And even if you're not a patient, you're watching online. So this first picture here is a picture of Lisa in my office. She's laying on the ground. She's got her butt on the ground and her feet out in front of her. And her goal here is to try to touch her toes. You know, a lot of my patients, they're 8, 12, 16 inches away from touching their toes. You know, when you were little, when you're a preteen, you could definitely touch your toes, no problem, super flexible. So what happened? Well, we probably neglected ourselves. So this is a great stretch to help increase your flexibility, take the pressure off the discs, the nerves, the ligaments. One of my buddies, took him 2 years of doing these exercises before he was able to touch his toes. He's so excited he can touch his toes now. So first thing we do is you sit, you take a deep breath in, and as you go to touch your toes, you breathe it out. The next picture shows Lisa sitting there, and what she's going to do is, so many people now, you know, they have this forward head posture. So the next exercise is Lisa extending up. So after you come down and touch your toes, then you come back up, so you extend. So you take the deep breath in and extend, and then when you go to touch your toes, all the way out. So you get this pumping motion of the spine. It's kind of euphoric as well. The next picture is Lisa with her legs crossed, and she's basically touching her hands out as far as she can onto the floor. So you breathe in, and with your legs crossed, you all the way out as far as you can, hold it for a sec, and come up. And I recommend doing this 12 times, so you get 12 deep breaths. You can see the stretch. It's a great stretch. The other thing that I recommend is foam rolling. In this next picture, you'll see Lisa. She's got the foam roller kind of in her middle of the middle of her back, so right in this region. And she's going to roll the foam roller up and down the mid-back region, so we can get into extension through our mid-back. Not necessarily our neck, but more of our mid-back, because so much of us are like this. Creates shoulder problems, carpal tunnel, headaches. People always ask me, well, oh, my head's out 2 inches. Do you think that would cause my headaches? And the answer is absolutely. So she's going to roll up and down on this foam roller. The first picture is lower back, and then you'll see she lifts her butt up off the ground in this next picture, and she's going to roll up and down on the mid-back, so that you help stretch and open up those joints, the discs, the ligaments. It just feels good. A lot of times I like to just hang out into extension just for a couple minutes, not even really move. You can also do this on the bed. You lay over and put the bed on the mid-back. But I really like the foam roller because you can roll it around and you can really, really get in there and just make things feel better. So if that doesn't help clear out your spinal issues, you definitely got to come see us. Free consultation to determine if chiropractic's right for you. You just call our office, 360-260-6903.